I know I asked someone to have a joke prepared today, but I don't remember who it was. So I'm hoping whoever it was. Aha, excellent. Okay. Thank you for volunteering and not taking advantage of my increasing dementia.
Okay. Why did the mermaid wear seashells?
Why did the mermaid wear two shells or seashells?
Seashells.
Sea, okay. Why did she wear seashells?
She outgrew her bee shells.
Okay, I didn't see it coming. Yeah. Yeah. And of course, yeah, two shells would not have made the would not have let the joke work. Okay. So last time we're going to finish up chapter 9. Last time we talked about Semmelweis and the fact that it's not enough to be right in science, you have to be heard, and all sorts of things happen in the way of that. And um, my only point is just to remind you that for all the loftiness of what science can do and might aspire to do, it is at heart a human enterprise with all the pluses and minuses and you know, light parts and dark parts that are involved in every human enterprise. So we were talking about, after we'd gotten through the three stages of delivery, right? Labor, which takes the most time, delivery, and afterbirth. And so one of the things that has to happen for the child to survive after that is it has to be fed. And there's a great deal out there about whether breastfeeding is good or bad, better than bottle feeding, et cetera. And and I I I don't really have a stand to take about that, and it's not clear to me that there's a consensus. But I will say that if the mother can successfully breastfeed, that she provides in her milk all sorts of things that simply are not available in any bottle, in part because we don't know quite what all is in milk. First of all, human breast milk is, sweet. There's quite a bit of sugar in it. And the baby comes out already preferring sweet flavors to others. And that's a plus and the minus because if it's offered a bottle, say, of sugar water, it will avidly suck on that. And all formulas have enough sugar in them to make sure that the baby wants to eat it. But the main thing that's in there is all these vitamins, which we can measure and therefore we can approximate in formula. But there's other stuff in there like antibodies and enzymes, including antibodies to any um, bacterial thing that she ran in or viral thing that she ran into lately, et cetera. And so there probably is some immunotherapy involved in breast milk. On the other hand, if either the mother or the child have a hard time breastfeeding, uh, of course, it's good to know that there are alternatives and handled properly. Um, formula will work just fine. People have looked hard to find differences later in life and health outcomes between babies that are breastfed and those that are fed on the bottle. And I think by and large, the answer has been there's not much difference. No one's found much in the way of that. The only category or the only thing that's clearly established is in general, babies that are breastfed do not gain weight as quickly as babies that are bottle fed. And that's probably just a matter of how much easier it is to get formula out of a bottle than it is to get milk out of breasts. And so you might wonder if that then leads to health disparities. But the answer seems to be no. So the breastfed babies will catch up to the bottle fed babies eventually, and there's no difference between them. All of this is presuming that you use breast milk use formula in a responsible way, right? That you make sure not to introduce bacteria in the formula. But That's all made pretty easy, at least in our culture. Question about that. The other thing that's cool about breast milk is that as breastfeeding continues, the composition of the milk changes. And presumably, this is a response to natural selection and is indicating, things that have proved valuable over the millions of years that humans have been doing this. And so, on the one hand, you think that's really cool. On the other, it is. And therefore, how come there aren't any health disparities that anyone's been able to detect? And uh, my way around that, and I suppose this is my way of encouraging you to breastfeed if it works for you. Um, my point around that is when people do epidemiology, you perforce put together in one category a huge number of people. These are the ones that were bottle fed, and these are the ones who are breastfed. And so, what we don't know and can't know is whether within each of those groups there are people with particular genotypes or particular situations, for example, who in fact do better than other people of that kind, that is, who share the same genomes and things like that. Put another way, that when you look at large populations and you're looking at a totally, incredibly heterogeneous genetic background, there might be effects that you can't really detect because you don't know which genes are important for which factor. All right. That's just my hedging of saying, you know, I would bet that if you can successfully breastfeed, there's probably an advantage there, even though I can't tell you any data that shows that that's the case. I guess I'm just putting faith in, 5 million years of evolution, natural selection. Question. Yeah, good. You have a question about breast milk? Yeah.
But
Yeah. So, I mean, in breastfeeding, there are several things that could go that, can arise, all of which are manageable, right? Because until the 20th century, everybody figured it out. But yes, it sometimes happens that breast uh, ducts can become clogged, and massaging and things like that can you know typically alleviate that. Warm washcloths, stuff like that. I'm not prepared to give a whole La Leche League presentation because I don't know all that stuff. But I know that it's all manageable. The question of whether some babies suck more vigorously and therefore um, avoid that, I really don't know. I mean, it doesn't strike me as unlikely, but it also sounds to like one of those post hoc explanations. Um, the other thing I'll remind you about is that the mother will continue to provide breast milk. First of all, remember the suckling triggers another oxytocin response, right? The stimulus of the baby sucking on the teat reaches the mother's hypothalamus. She releases oxytocin, which goes to the breast to stimulate those muscle fibers that squeeze the milk out, so-called milk ejection. And as long as that process goes on, she will continue to make breast milk. And it's pretty clear that in pre-literate, pre-civilization societies, it wasn't unusual for a child to be breastfed for years, maybe 6 years or even more as a supplement, even though they're taking on firm food. Um, and in those societies where food is scarce, typically, as long as the mother's breastfeeding, she's unlikely to ovulate again, and therefore not likely to get pregnant. In our society, breastfeeding is a lousy contraception because, be, presumably because our health and nutrition is so much higher. There's plenty of food around. Most women, even if they're breastfeeding, will shortly begin to ovulate again, and therefore could get pregnant. The so-called Irish twins, right, who arrive 11 months apart or something like that. That's not uncommon if there's no contraception used. Yeah. Questions about? I mean, in some ways, I mean, the whole idea, I mean, look across the animal kingdom. In some ways, breastfeeding is magnificently strange, right? I mean, it's what a weird thing to do, but um, we mammals wouldn't be here without it. And it's and to put it in a bigger context, this is one of the ways in which mammals invest so much more resources in each offspring than any other part of the animal kingdom. Second, what's the part of the animal kingdom that it provides the second most investment in offspring? Birds, right? Is that what some yeah. It's birds who I mean, most birds have to have parental care or they won't survive. Loads of reptiles and amphibians never even meet their parents, much less get any resources from them. And it just so happens that those are the two parts of the animal kingdom where the brains are the largest. And this is not a coincidence. If you want to create a creature that has really large brains, you invest a lot of resources in it and take care of it a long time. And that's what mammals do more than um, any other species on the planet. And among the mammals, nobody invests as much time and resources in their offspring as humans. Okay. And I can't talk about pregnancy without talking about something that people used to never talk about, which is the occurrence of postpartum depression, which is not uncommon. And people recognize that this happened once in a while in years past, and it was typically dismissed as, you know, a phase, etc. And indeed, most mothers eventually recover spontaneously, but not all did. And these days, there are things that can be done when people are experiencing postpartum depression. The number one being cognitive therapy, right? So seeing a counselor, talking about this, and there are also, when in cases where that doesn't help, there are also drugs that can be used. And a lot of concern has been put out there about taking antidepressants while breastfeeding. And we know for certain that the antidepressants do, some of them get into the breast milk, but so far the epidemiology does not suggest that the baby, suffers any health consequences from that. How's that? Questions? And again, if you haven't, and if your mom's available to you, talk to her about your birth story, what it was like, what was happening, and I don't were you breastfed or not, and how was that? It's yeah. So question to some extent, anytime you're talking about contraception in the modern world, abortion is the elephant in the room. The topic that people are thinking about and may or may not feel comfortable talking about. And so I just want to say from the beginning that this is a complex topic and it's one in which people feel very strongly, and yet they don't agree, right? People that feel very strongly and are on opposite sides of the question of whether abortion should be permitted or not. And as in all these discussions, I want to remind you that there are people who believe quite the opposite of what you believe, and they are not bad people, and they're not stupid, and they're not evil. They just disagree with you. And so, at least in this class, and I would hope in any discussion on any topic in a university, um, you it it's better for everybody to treat other opinions with respect and with some recognition that people may feel differently than you without there necessarily being villains. And on the personal side, I will tell you the thing that has been so strange for the past decade is in American political discussions, this sort of polarization where if you don't agree with me, you're the enemy and you have to be fought that way. This is totally aberrant. And it's not, this is a new thing. And I'm sorry that you're exposed to it. And I don't know if it's ever going to go, anyone's ever going to put that genie back in the bottle, but it's totally counterproductive. It's destructive and it's hurtful, and it's not the way for civilized people to figure out what to do. Okay, off my soapbox. The other thing I'll say about abortion that makes it a complex topic, and, and I will say um, that if here, if you are someone who thinks that abortion is always okay, no matter what, and you are someone who thinks abortion is never okay, no matter what, I respect those opinions, but I I got to tell you, I don't think you've been thinking very carefully, right? Because it's a complicated issue, and if you think it's simple, then you haven't thought about all the situations that can occur that make it a complicated issue. Okay, so first terminology. So in fact, what people term as a euphemism miscarriage is, in medical and biological terms, an abortion. So anytime an embryo has begun and doesn't come to a successful end of a pregnancy with a delivery of a live birth, that's an abortion. When it happens early in life or early in development, the mother may not even be aware that an embryo was ever there. Right? All sorts of reasons that could happen. Maybe that particular combination of genes didn't develop properly in order to implant in the uterus. Maybe that particular egg got fertilized too late in its passage down the reproductive tract to be successfully implant. Maybe it implanted and got part way, but something went wrong at some point, and so it failed to maintain the endometrial lining and was sloughed off. So um, those sorts of abortions happen all the time. Anytime someone is having sexual relations, heterosexual sexual relations, I mean, and not using contraception, they're going to be miscarriages or spontaneous abortions. What causes the problem, of course, are the other kind of abortions, which we'll refer to as induced abortion. And among induced abortions, we can basically classify them two ways. They're therapeutic if, in fact, it's it risks the health of the mother for the pregnancy to continue. And there are all sorts of conditions that can give rise to that. And number one, I don't know them all. I'm not a medical doctor. I've never done any clinical things. But also, um, in terms of the ethical and moral issues involved, it doesn't matter, right? It is take my word for it. There are times when there's a risk to the mother if the pregnancy continues. The rub, of course, is how do you, judge how much of a risk it is to the mother, and who should decide whether there's enough of a risk to the mother to terminate the pregnancy. Those are thornier issues, and I won't be going into those either. However, there are plenty of abortions that happen in the United States these days that are clearly elective, where it's not that the mother's health is endangered or that the offspring doesn't have a chance of surviving, but because she doesn't want to continue the pregnancy. We'll talk about the reason behind that in a moment. And then, of the kinds of abortion, it used to be that the only sort of abortion that was available was surgical, where someone would have to enter the reproductive tract, typically go through the cervix, and stop the development, and which typically would then um, induce the expelling of the fetus. So those surgical methods used to be about the only way that it could happen. Then in the late 20th century, pharmacological abortions arose, where people developed quite purposely. This was not an accidental development. Just like the development of the contraceptive pill was not accidental, they understood the endocrinology well enough to know how the pill would work. And so it was concerted effort to find a way to cheaply make enough estrogen to make the first pill. Likewise, here, um, the the pharmaceutical company, Roussel Uclef, that originally developed it, they were trying to find a compound that would block progesterone receptors because they knew that to maintain the endometrial lining of the uterus, that requires progesterone from some source. And since the progesterone is coming from the fetus itself, the only way to interrupt that would have been surgical. But if the progesterone is going to be there, could they come up with a pharmacological agent that would bind the progesterone receptor but not activate it? And that means that if the drug is sitting in the progesterone receptor and progesterone can't get to it, then the biological effect of progesterone is lost and the endometrial lining will be shed. And that means the end of the pregnancy. Questions about that? Oh, and the drug will give the. I always think of it as RU486 because when I was in graduate school back in the 70s, that's what they called it. It just stood for Roussel Uclef compound number 486 that they tried. Um, so, and I, I have to, I, I keep forgetting the brand names, et cetera, but we'll get there in a moment. Um, and these days, medical abortions are much more common than surgical abortions for, for reasons that we'll discuss in a moment, primarily being they're cheaper and safer. So, um, it, in talking about abortion, it's important, I think, to keep in mind what I was getting at when I was talking about the number of miscarriages that happen, which is lots of things can go wrong between the creation of a zygote and the creation of a human being, right? So uh, sometimes conception doesn't happen. Even if it does, sometimes the embryo is lost before it is implanted. Sometimes the embryo is sufficiently advanced that it does manage to successfully implant, but something goes wrong, and then it's lost. And um, and then there are other cases, and when this happens, often nobody's aware that it happened. The mother might realize that she's several days late on her next period, maybe even a week, but then her period comes and there's no way of knowing what happened there. Then there are times when there are clinical cases where the mother knows that she's pregnant and is expecting a pregnancy, and then it's lost spontaneously. And the estimates are that if we look at from conception to et cetera, that the live birth is the exception, not the rule. There are fewer live births than spontaneous abortions, for example. And um, if and that really hasn't changed. If anything, contraception has maintained that. How's that? Why do people have elective abortions? In surveys, it's pretty clear what the big three reasons are, and I'll bet you could have predicted them. One is this is a bad time to be pregnant. Maybe because of career, maybe especially in the old days when there was so much stigma attached to unmarried mothers. Maybe, they just couldn't take the stigma that would attach to that. Or they don't have the money, they don't have the resources, there are already too many children. I mean, there are all sorts of reasons why people might feel the timing is wrong. Right up there with that is financial, right? There's just not the money right now. Having a kid is expensive. And as we talked about before, whatever the talk it is you hear from our government about how concerned they are about the welfare of children. In fact, you will not, I mean, you will have to spend a lot of your resources to successfully raise a child. And there's no welfare, no tax breaks, nothing comes close to making up the difference. And anyone who's had to live on a budget, can see that right away. And then in some cases, it is they've already had children, and yes, they could afford to have another child, but they feel like their family's big enough. And maybe their children are grown, or maybe they still have children at home, and they want to invest in those children. And I think these are all perfectly reasonable or perfectly understandable reasons. After that, there are things that get to be little less common, but you know, happen. Questions about that? Notice that it'll interfere with my career or plans. I think there's a tendency among abortion critics to criticize women who have an abortion as if it's some trivial reasons, like they're more interested in their career than saving the life of this child, right? In their minds. But notice that that's rarely the the case. Why is that? If in fact the woman's concerned about her career, right? And is, you know, why is it that she's not as likely to want an abortion than other people? Why is that? I mean, you already know. Think about a woman who is on a professional track for a career, for example. Is she likely to get pregnant when yeah. She's very conscious of her decision I and she's very likely to use contraception, right? So when you hear that criticism, that these are people who, are so selfish that they're thinking about the careers only, that's not the motivation behind most abortions, not in this country, right? Because people, educated people, as we've said before, are more likely to use contraception than uneducated people or less educated people. And upper class individuals in our nation are more likely to use contraception than lower class. So that's why it is probably pretty rare. Um, and in some cases, there is concern about the health of the fetus. It might include, for example, amniocentesis has shown that there's a problem with the baby. Maybe it's Down syndrome, maybe it's something else, and they've decided they don't want to take that on because, as I've said, there are all sorts of conditions where, as we've talked about before, I mean, in the normal course of events, you have a kid and eventually they're going to be taking care of themselves, right? We used to say, once they're 18, they'll be taking care of themselves. And now we say, once they're 30 or so, they can take care of themselves. And I can tell you that I'm sure that as soon as my kid reaches 50, I'm going to stop worrying quite so much about their lives, right? So, I mean, it's a big deal. Um, but if you have a special needs kid, you have to keep in mind that the child is likely to outlive you. And so, who's going to take care? No matter how much you sacrifice your own life to look after that kid, who's going to take care of it when you're gone? And that's something that millions of American parents face right now and all the time, and probably always will. And so, if before the baby's been born, there's that sort of problem, that's an issue to consider. Good. Well, I mean, these are the answers that people give, and which I'm not ready. Which one were you talking about? As typical in a survey, they're given some options and asked to check which one they feel is most applicable to them. And it's always possible, of course, that they're being dishonest. But these surveys also always try to make it clear that they're anonymous. And so you have to wrestle with yourself about whether they would, you know, try to try to fool the researchers in terms of what their motivation is. Yeah, yeah, good point. And that is how, know, what is what is the primary reason why you're doing it? Maybe even says that, but that's so the point's well taken. Others. question. All right. First, let's talk about surgical abortions. So, in surgical abortions, as I said, you're going to physically enter the uterus and do things that will keep the pregnancy from continuing. In the first trimester, first of all, in the first trimester, most abortions are medical, but we're talking about that minority of cases where the abortion is surgical. And in those cases, first you rinse the vagina of antiseptic because you don't want to introduce anything into the uterus that could later endanger the health of the mother. And then they use things to make the cervix dilate, basically suppositories that infuse things like prostaglandins and things like that to make the cervix pharmacologically go along the pathway, before labor. And then they pass a cannula into the uterus and where they try to make sure to go past the cervix itself and then aspirate vacuum, vacuum out the um, the the embryo or fetus that's there. And typically, when that's done, they look at the tissue that's coming out to confirm that there is an embryo in there. Or if things are early enough, it might not be that easy to find the embryo because it'll be so tiny. But that's typically done. And then they may go in and clean the uterine walls with a curette, which is basically, you can just think of it as a serrated blade where they're going to clean the walls of the uterus, if it's done properly, only the endometrium. And all of that um, is to make sure there isn't some fetal tissue left in there that could continue to grow and cause a problem for the mother. At that point, once this is done, the major concern is hemorrhaging, bleeding. And so there are things that can be done to reduce bleeding, including, Pitocin or things like that, to try to get the uterus to clamp and shut off any bleeding that's going on until the individual can recover normally, by which I mean go through the same process that happens at the end of every menses, where the endometrium lining has gotten thicker, but now it's lost through the menses, and the ovulatory cycle can start again. How's that? And and sometimes this is known as dilation and curettage. So dilate the cervix, curette the endometrium, and or DNC. And that was much more common uh, before suction was used. So here's an example of how that would be done. A speculum is used to enlarge the vagina and give access to the cervix, and then it's put inside the cervix, and the materials are suctioned out. And if nothing about that makes you uneasy, then you know, I don't know, you need to check in on that because that should make you uncomfortable. Um, if things are further along, we're typically in the second trimester. More serious steps have to be taken for the abortion to take place. They are generally done under general anesthesia. Oh, I should have said, for a DNC, typically the mother is not anesthetized. She may be given some drugs to reduce anxiety, and there will certainly be local anesthetics used. And yet, still, it tends to be a painful procedure. For when things are further along than that, for a dilation and evacuation, uh, generally the mother is anesthetized, which, these days is very safe, but there's always a risk with general anesthesia. The cervix typically has to be dilated more with the DNC, and part of the reason for the general anesthesia is that further dilation is going to be painful. And then aspiration is used, and because the opening of the cervix has been made large enough, they might use forceps to remove tissue that would might not come out um, with aspiration. And again, they'll use a curette to clean the lining. And so all of this is to avoid leaving in there a dead tissue that the mother's body can't deal with naturally, as happens with, for example, the endometrial lining every month in a normally ovulating woman. So it is in a hospital setting, it's incredibly safe, but it is more likely to lead to complications than a DNC. The complications being bleeding and infection and things like that. Those being the two big ones. Questions. Sometimes it happens that a pregnancy is pretty far along and um, they feel like the safest way to end the pregnancy and preserve the health of the mother is to induce labor and have a hysterotomy. So hysterotomy means it's not a hysterectomy. They're not going to remove the uterus, but they are going to take out chunks of the endometrial lining because things have developed quite a bit along. So it is a riskier procedure, about which more later. So the first thing they do is induce labor by injecting a strong saline solution in the amniotic sac, and or they might use prostaglandins, get the cervix to relax and open up some, and then that will induce labor, and then all the things that happen in labor will happen as well, which is first labor, which may be prolonged, especially if it's the first child, then delivery, which doesn't take very long, and then waiting for the afterbirth. And um, one of the reasons why this happens is if the fetus is dead. So if they know that the fetus has died, the safest thing to do when things are pretty far along is to have the mother deliver the baby, knowing that it's dead, and go through all that labor to do that. And I've known people that had to do that. Any of you known someone had to induce labor and had to deliver a baby that they knew was already dead, right? And so these are people that wanted a baby. So it's a tough situation. And um, if labor's risky, then they can do a hysterotomy to remove the fetus under anesthesia. It's basically a C-section, but there's no intent, or they know that the baby is not viable. So far, I hope you're uncomfortable. That's good. Now I'm going to make you more uncomfortable. And I'm going to talk to you about a procedure that I'm not sure even happens, but it's definitely a part of the debate, so called late term abortions, where a viable baby is well into the third trimester and where supposedly the, the baby is still alive and they manipulate the fetus and deliver the lower body. And then, and if this doesn't make you uncomfortable, again, there's something wrong with you. And then puncture the brain case while it's still inside the uterus and basically aspirate out the brain and the head. And then the rest of the baby will come out. Um, the AMA says that it should only be done if the mother's health is at great risk. And as I said, it's not clear whether this has ever actually been done in the United States. I mean, you assume, well, sure, it must have happened once or twice, but if it's happening commonly, no one seems to be able to find evidence of that. And yet, in the political debate, it's front and center in the discussion about whether abortion should or should not be allowed. It is to make sure that the fetus is dead before it comes out, and the idea is that once you make the head smaller, the delivery will be relatively rapid because the head is the biggest portion. This is also the reason, supposedly, that you have the body come out first, because if the engagement has happened and the baby's head's down first, um, then it would be harder to get to the brain case. Yeah, yeah, yeah. I'm sorry. Say that again. Uh huh.
Mhm. They can partner with anyone. And it with regards to that claim to have survived
Oh,
partial.
oh. Okay. I that there are people that have claimed to have survived a partial a a partial birth abortion. So clearly they didn't go through these steps, and so I don't know anything about that. And like so many things, especially on the internet, it's not entirely certain that everything on the internet is true. So yeah, sorry, I don't know. Yeah, good. Say aloud. Why don't they do a C-section? Exactly. You'd think that'd be one, except there is an ethical problem. If you do the C-section and the baby is there in front of you, then or the late term fetus, then the idea, I suppose, is that it is more obvious what you're doing. Plus, cesarean sections, are more complicated, have more risks, stuff, longer recovery, all those things. And if you're and we'll talk in a moment about that. And of course, one could design legislation to make sure this never happens. What would that legislation be? What would be the one simple, well documented piece of information that would let you decide it shouldn't be allowed? Yeah. Well, yeah, that's one way, but yeah, you're right. You're right. So absolutely no abortions for any reason. But I was thinking of something a little less draconian than that. So, and what is it? Where? Oh yeah, thank you. Yeah, in the third trimester. So it could be as simple as past a certain age, past a certain stage, menstrual age, right? And we know that babies, fetuses, af bless you, around 22 weeks of gestation sometimes survive, right? So anything before that, it's not a viable fetus, and therefore nothing like this could be going on. We'll talk about that some more. And but first, let's talk about the other way that abortions happen in this country, which is far and away the most common in the United States. It's only possible relatively early in pregnancy, can only happen in the first trimester, first 13 and a half weeks or so. And that's the use of mifepristone, which I'll forever only think of as RU486, that blocks progesterone receptors. So it the drug also is sometimes used in chemotherapy because it inhibits rapidly dividing cells. But typically, something like, oh, I see, methotrexate is another chemotherapy drug that also works, but far and away the most common is RE486. Either way, first there'll be treatment with misoprostol, which is basically synthetic prostaglandins to trigger contractions after the RU46 is on board. And so, in normal pregnancy, progesterone that is originally from the ovary and eventually from the um, driven by the fetus is keeping the endometrium alive, and mifepristone simply interferes with that. And then misoprostol is then given to cause contractions to expel the fetus, and to also, of course, close off the uterus to avoid excessive bleeding, and um, that's how it's done. The One of the things, this procedure is so safe when done early in gestation that, and a big part of the controversy that's happening right now is that a video consult with the patient to make sure you understand the gestational age, maybe even look at the patient to see how far along they are, means that one could mail them the drugs and simply tell them, take this drug this day and this day and this third day, and let us know if you have something more than a heavy menses flow, that it can be done through mail order. And this is, of course, being used right now to get around legislative barriers to abortion in certain districts. So, what's interesting is the loss. I do this in the wrong order. Where is it? Um, In 1973, there was a Supreme Court decision called Roe v. Wade that basically said that a woman has a constitutional right to decide what's best for her body. And that was overturned. Still not there, sorry. And, hmm, sorry, the slide I'm looking for isn't there. Anyway, that was recently overturned, as you know. I know I have a slide about it somewhere. Um, what's interesting is because of the since 1973, um, in because of more widespread contraception, in fact, the number of abortions had been going down steadily for quite some time. So, still, it's a large number in 2016, and it was at that point the lowest rate since 1973. This is the latest report we have available to us. One of the things that happened was that teenage pregnancy rates were down 7%, etc. And two-thirds of the abortions were in the first trimester. 91% were part, two-thirds were in the first 2 months of the pregnancy, and over 90% were taking place in the first trimester, and 9% were surgical after the first trimester, and only 28% in those days were induced at or before 8 weeks and through medication. But that number has grown. Questions about those methods? Good. This is all abortions. Oh, I see. No, no, these are not spontaneous abortions. That's the important point. Um, so it is lumping together those that were elective and those that were medically indicated. And one question you have when things are happening in the first trimester is is the fetus having any pain? And in a neuroscience course, right, we are prepared to answer that question. And the answer is in the first trimester, quite clearly no. There's pathways simply aren't there. There's no neural system to mediate pain. There's several ways that one can keep track of that. Withdrawal reflex, the pinching of a limb followed by flexion that brings the limb back to the body, that's a purely spinal reflex. And that appears very early on, in part because motor neurons are among the very first neurons to develop and send their axons out to the periphery. And likewise, muscle afferents are among the first to develop. But that doesn't mean that there's any pain being perceived. And because, of course, for pain to be perceived, the pain signals have to reach the brain. And in fact, fibers from the thalamus that would is the pathway by which pain reaches the brain. Those fibers will come around about 23 to 24 weeks of gestation, maternal age, and a EEG response to somatosensory stimuli, touch or shock, things like that. Those won't happen until 29 weeks of maternal age. The For the fetus to show a facial wince in response to a pinch, that won't happen until much later than that. And so you can read about this if you like in this article. Uh, and they concluded that the fetus can't feel pain until about the 29th week of gestation. Pardon me, 29th week of maternal age. And the earliest that a fetus can survive outside the womb is about 22 weeks. So there are babies that are born prematurely that probably can't feel pain. And that's one of the reasons why it's more difficult to keep them alive. But um, medical centers have gotten better and better at it. And so I can tell you within my lifetime, a fetus being born at 22 weeks of age that ever survived, that would have been a miracle, right? That's only happening through improved medical technology that can happen. Questions about that? Good. So if you were a person, if you thought the fetus was feeling pain, yes. To say that they do present pain, that they do feel pain. Well, one is that the withdrawal reflex is there, right? But the withdrawal reflex happens even if there's no connection between the brain and the spinal cord, and that's a purely spinal reflex. And so I mean, and it is mainly done to try to generate antipathy to abortion or opposition to. I don't to abortion. Um, and and of course, this is all neuroscience, but there's no way to ask the fetus what it's feeling. Absolutely, yeah. They won't survive without a neonatal intensive care unit, NICU. Yeah, and it's again that's a lot of hard won knowledge that only came about, by the way, of premature babies where they did everything they could to keep it alive, and for the most part, they failed, right? And so, but they do keep pushing it back.
Or they things that allows because it would
No, no, no. They have to stay in the NICU much longer than a regular pregnancy. No, no, they'll typically at 23 weeks of age, they'll be months, weeks, maybe months in NICU. They are, of course, born at a low birth weight. We've already talked about how, in general, the lower the birth weight, the higher the birth weight, the better the health outcomes in the future. And they are definitely more likely to have health complications than babies that are, delivered at term. Having said that, now there are plenty of people out there who survive that and you know look like they're having perfectly adequate, happy lives. Right. Okay. And one of the things that drove the campaign that eventually resulted in the Roe v. Wade decision was that until that happened in the United States, first of all, in the United States, up until that time, there were some jurisdictions where abortions were legal and some where it was not. And so what was driving it were the case were those cases where a woman happened to live in a jurisdiction that made it illegal and um, felt that she was suffering some consequences of that. But that was relatively late in this process. Until the mid 1960s or so, the only abortions that happened were illegal, and that meant that, for the most part, they were not very well done. A study in 1932 estimated that there were 15,000 illegal abortions a year in the United States. Partly this was because of the great many of these women were getting an abortion because they were single, unwed, and there was so much stigma attached to having a baby if you weren't married, that they looked for an abortion in order to continue with their lives and avoid that stigma. Um, Good, yeah, right. Um, yeah, so I mean that is the image that's put out there, and of course it's a visceral image, um, but yeah, some women would unwind a clothes hanger and put it through the vagina, try to get it through the opening of the cervix and put it inside the uterus. And that would do enough damage that eventually, delivery would happen. It's risky because, of course, if the clothes hanger goes through the uterine wall, there's going to be internal bleeding and bleeding through the vagina. And so many women died. Even so, most illegal abortions were done when someone claimed to be able to cause the abortion safely and they were paid to do it, but they were paid quite a bit because, of course, there's a lot of overhead when you have to bribe police and judges and have to avoid the law. And so, anyway, in 1930, and this is a time when it was totally illegal, over up to 3,000 were reported, right? Where the authorities came to know that an abortion had taken place, either because the mother showed up in an emergency room where her life was in danger, or she was found dead and they figured out that that had happened. So probably the number per year was somewhere in between these two numbers of 27,000 and 15,000. And questions about that. And I'll point out to you that the population of the United States was a lot less in the 1930s than it is today. So that was a lot. So a 1940 study came up with this number. For the most part, the estimate is there were probably about 5,000 or 10,000 a year. And um, death rates declined once they started being performed by physicians. And and that was happening in the 1950s. But there was a class aspect to that. So a dear colleague of mine who's passed away now, Arnie Lyman, we wrote a textbook together. Um, as a young man, he was working in Chicago as an aide to a physician. And one of the things he noticed, and this was during the 50s, is that a lot of their cases were the surgeon would go in and perform an abortion because the mother had German measles, and it was known that German measles would cause birth defects. And as they were scrubbing in one day, he said to the physician, "Gee, there seems to be like a German measles epidemic happening around here." And the surgeon said, "Don't be a smartass." Because in fact, these were not cases of German measles. These were cases of people that had enough money that there was a doctor who would claim they had German measles and give them an abortion. But if you didn't have that sort of money, didn't have that kind of relationship with a doctor, you weren't going to have an abortion. So most of the illegal abortions were by the 1950s were being done by people of the lower classes who didn't have as much money and resources, and therefore were taking on that risk. As I've said repeatedly, in this country, class always matters, right? In everything. Questions about any of that? American attitudes about abortion are complex. If you, there's definitely an age variable. So, under what circumstances should abortion be legal? Most cases, or illegal in most cases. When you talk to people of a younger generation, they are less likely to think that abortion is should always be illegal. Notice that none of these, it is legal in most cases or illegal in most cases. Almost nobody answers it should never be legal or it should never be illegal, right? Those are extreme positions that are relatively rare. Certainly, and in my case, I've never met anyone who thought it should be legal in every case, right? I haven't met anyone who hearing about so-called late-term abortions and asked if you think that's okay. I haven't met anyone who thinks that that's okay. Have you? Ask around. Um, and in terms of when should it be illegal, for the most part, the later the pregnancy, that's perfectly understandable. The more likely they are to think that it should be illegal. And in terms of a reason, again, most people think that it's okay if the mother's life is in danger. And then another big turning point is, should a woman who's been raped be required to bring the baby to term? So nothing wrong with the health of the baby, nothing risking the life of the mother. And in certain jurisdictions, that's not a reason anymore for a woman to have an abortion. The the laws in those states say, well, you were raped, and that's too bad, but now you got to carry your rapist child to term, and then you got to decide what to do with it. Um, in terms of whether it's because of they can't afford it, kind of a 50-50 situation. The feeling that the book talks about a little bit, the feeling that at the moment of conception, once an egg is fertilized, that this now represents a an individual with a soul and therefore should have all the rights of a human being, um, has generated a lot of emotion, including a lot of violence. There have been physicians killed, murdered, assassinated, not because they were doing abortions, and um, laws keep, yeah, and things differ across jurisdictions, and I don't claim to be totally up to date on what the differences are across jurisdictions, but the changes are happening, and immediately after the change in the law, um, or before the Supreme Court weighed in, as different states started passing more and more restrictions on abortion. One analysis found that if you look at searches for people to figure out Google searches to see how to self-induce an abortion, they took a big rise as the political campaigns to outlaw abortion kept happening, and that's probably an indication that people were that desperate. And the the Roe v. Wade ruling was overruled in 2022, and the restrictions from state to state have just gotten more severe after that. And I don't think anyone knows where it's going to be, where it's going to end up. Um, and it's clear that that overthrow had an effect, that there were fewer abortions because of that. 14 states passed very restrictive laws, and it's clear that there were not as many abortions happening because 30,000 more births were happening than the trends had suggested. So that's 30,000 babies. They were born to a mother who had one of those reasons to not want to have a baby right now. And maybe some of them are giving up for adoption, but probably most of them um, were raised in a situation where the mother felt like she couldn't take adequate care of the baby, but had no choice. And most of the extra births, you'll not be surprised to learn, are happening to the lower classes because if you have enough money, you can drive or fly to another jurisdiction where you can get the abortion, which is exactly what was going on in 1973 before Roe v. Wade, which is if you had enough money, you flew to the state, Hawaii, for example, where abortion could take place. You stayed in Hawaii for a while, and then you came home, and nobody ever knew you had an abortion. and you just went on vacation, etc. Kofi, when were when was when was the survey conducted? Yeah, those are from the books, and so those are from probably they are from pre-overturning of Roe v. Wade, but pretty close to that. So probably about 1922, 2022. Pardon me, 2022. No, I don't remember 1922. I know everything. Okay, and yeah, so there are plenty of babies out there, um, and you got to think about this for a little bit. There are plenty of babies out there uh, that were unwanted.